Hi, we are Group 1 of Global Nutrition and Food Security, and today we're going to talk about food insecurity and the impact of COVID-19 in Mexico. We're going to start with the problem analysis and its determinants, how COVID-19 impacted Mexico, and what strategies have been followed to address the problem before. We follow with the proposal of public health nutrition program that hopefully may serve for similar challenges not only in Mexico, but other countries as well. COVID-19 impacted worldwide, worsening inequity and sharpening food insecurity in low and middle-income countries, including Mexico. Food insecurity to the lack of access make people eat the most accessible, commonly junk food, such as high energy, high in saturated fats, sugars, and salt. These types of food generates a feeling of satiety by recovering the body's energy, but without any other nutritional value for the body. Prolonged periods of insufficient food can induce physiological changes that contribute to overweight, obesity, and the development of chronic diseases such as diabetes. This combination of problems, known as the triple burden of malnutrition, is more common in low and middle-income countries with food insecurity. Before the COVID-19 pandemic, only 44.5% of households were identified as food secure, with a difference of 18% less from urban to rural areas. This dropped to 40.9% in 2020, and the main reason for this is the low income, which accounted for 42% of poverty in that year and increased to 44% in the next one. That means that 6 of every 10 households suffer from any level of food insecurity. Households more likely to food insecure include those with younger, less educated household heads, headed by single widow and divorced women, with disabled house members, native speakers, with children, and as well as rural and lower income households. According to the National Health and Nutrition Survey of 2020, 34% of the households stopped receiving income from at least one of its members. The average cost of food basket in that year was $762 for urban and $581 for rural areas per month. With a drop in the GDP per capita, that left us with $741 per month. The economic capacity was, in some cases, not even enough to cover the food expenses. In the stakeholder context, for policies and budget allocation, we need the National System for Integral Family Development through the Vulnerable Population Unit and the Secretariat of Welfare. For operations, the Mexican Food Security Federal Organization that was created in 2019 with the merger of Industrialized Milk and National Distribution and Promoter. The first one produces and distributes dairy products with subsidy from the government, and the second one distributes basic products and food. According to the stakeholder analysis, our priority is to get budget from the federal government to distribute food vouchers through the Secretariat of Welfare, coordinate efforts with Segalmex to deliver the food aligned with the programs already in place. For the monetization, we will use the National Institute of Public Health survey as well as the Coneval report. To increase the access of nutritious food, there are several types of programs such as food banks, community canteens, food pantries, and even economic support from the government. In Mexico, there are 149 social programs, from which only 20 or 30% are likely related to this social right of access to food, including social mix supply, scholarship of full-time schools, support for elderly, disabled, women care of families, and indigenous people. But only 6 of these are relevant to children and adolescents. The problem isn't new. We have had these conditions for a while. To address the challenge, the government developed the Scholar Welfare Program that started in Mexico City and spread all over the country in the 50s. Currently, there are 40,000 school kitchens and 5,500 community kitchens.